Miss. My name is Jack. I'm going to be your nurse practitioner today. How are you today?
I'm okay. How are you?
Good. All right. And can you tell me your name and date of birth?
Hazel Curry, 10/20/83.
Perfect, Miss Curry. Is it okay if I call you Miss Curry?
Yes.
All right. Just before I get started, just a couple questions. You do identify as the female sex, is that right?
Yes.
All right. And where do you work, Miss Curry?
I work for a pediatrician's office here nearby.
Oh, good.
The
Okay.
office manager there.
Nice. And do you like that?
I do.
Good, glad to hear that. Okay, so just want to kind of make a point that I've created a safe, warm, and private environment here for you. So I just want to ask, are you having any anxieties about the assessment today?
No.
Okay. Are you in any distress at this time?
No.
All right, great. Well, I'm going to go ahead and we're going to do a head-to-toe assessment. Is that okay with you if we get started?
Yes.
All right, great. So the first thing I'm doing is I'm looking at Miss Curry's head, and I'm noticing her head is nice and equal and round, symmetrical, good proportionate size for her body. I'm not seeing any masses, any lumps, no physical trauma to the head. Same with the face. I'm looking at the face to see equal features on both sides of the face. No lumps, no masses, no deformities, no abnormalities to the face, no drooping on either side. And so that looks good as well. And then visual inspection of the neck, just looking to see if I can, any deviation in the trachea, looking for any maybe obvious enlarged lymph nodes, of which I see none. So we're going to go ahead and assess cranial nerve 7. So if I can get you to puff out your cheeks for me. All right. Can you smile? And how about frown? All right. Good. Cranial nerve 7 is intact. So the next thing I want to do is we're going to auscultate your temporal artery. Okay.
Okay.
I'm going to be listening for any bruise there. Listening with the bell of the stethoscope. Bruise noted there, and on the right side. No bruise noted there. And I'm going to go ahead, is it okay if I palpate?
Yes.
Okay. So feeling for one side at a time, easily palpable on the right, easily palpable on the left, 2 pluses there. All right, so I'm going to go ahead and have a look at your scalp. Is that okay?
Okay.
All right. So, looking at Miss Curry's scalp, I'm looking for any signs of infestation on the scalp, and I'm going to move her hair around a little bit and have a look. I'm looking for any scaling, any erythema, any scabbing, masses, lumps when I'm palpating here, of which I see none. Also looking at the hair, I see that the hair is nice and evenly distributed, no signs of thinning or hair loss. The hair is nice and smooth in texture, so everything looks good to the scalp. So I'm going to go ahead and palpate some of your sinuses. So I'm going to start with the frontal sinus right here. And you just tell me if you feel any tenderness or pain, okay?
None.
Okay. And then moving on to the maxillary sinuses. Any pain there?
No.
Okay, very good. All right, so now I'm going to go ahead and move to the lymph nodes, and I'm going to start at the base of the cranium, and we're going to feel for those occipital nodes. Go ahead, young lady, get out of here. Okay. So, occipital nodes there, and then we're going to go ahead and move to the post-auricular nodes, and then to the front of the ear for the pre-auricular nodes. And then under the mandible, I'm going to be looking for the tonsillar nodes here. And then the submandibular nodes. And then the submental nodes here. Okay. And then we're going to move to the neck, and I'm going to look for the superficial cervical nodes. And then I'm looking for the posterior cervical nodes. And then the deep cervical nodes. I'm going to push a little harder for those.
Okay.
Okay. Then I'm gonna come down to the base right here and I'm gonna look for these supraclavicular nodes. Okay, so, none of the nodes were palpable and no obvious enlargement of the nodes, no movement of the nodes, so all normal expected findings there. All right. Now I'm gonna go ahead and I'm gonna palpate this TMJ joint right here. And if you could just open and close your mouth for me, and again, and I'm looking for any popping or any pain while you open and close your mouth. And no popping, any pain present?
No.
All right, very good. All right, so now we're gonna go ahead and I'm going to actually palpate the trachea here. And I'm gonna move it from side to side, looking for any deviations in the trachea, of which I see none. Okay, lift up. Okay, now I'm gonna go ahead and palpate the thyroid gland. And I'm looking for the contours of that thyroid gland. I'm gonna kind of displace the tissue some so I can find those edges. And go ahead and swallow. All right, when Miss Curry swallows, the thyroid gland lifts slightly, which is a normal expected finding as well. All right. Okay, so now I'm gonna go ahead and we're gonna move on to the eyes.
Okay.
All right, so looking at the eyes, first I can see that the eyes are nice and symmetrical. Both eyelids are present, eyelashes, the eyelids close and open spontaneously and fully. Looking at the palpebral fissures, you can see that those are of normal, regular size, no irregularities there. Then looking into the eye, I can see that the conjunctiva are pink, moist, but no redness, no discharge, no signs of infection there. The sclera are white, no signs of jaundice to the sclera. And then looking at the cornea, I can see that there's no opacities to the cornea, no abrasion, no foreign bodies or anything to that nature, okay?
Okay.
All right, so we're gonna go ahead and do cranial nerve number 2. This is gonna be your visual acuity test, and we'll also check for peripheral vision as well, okay?
Okay.
All right, so I'm gonna have you stand right here. And we have our Snellen chart. And all I want you to do is close, you're gonna cover one eye,
Okay.
and then read the smallest line that you can read.
EFTCC.
Okay? And then you'll cover the other eye and read read the smallest line that you can read.
It's really difficult to see with this eye.
Okay?
Honestly, the only clear one is the TFH. That's even right.
Okay? And open up both eyes and read what you can read.
CFDHJ.
Okay, so with both eyes, you have good 20/20 vision. Looks like the right eye was a little more compromised. 20/20 vision would just mean that you could see at 20 feet what a normal person with normal vision could see at 20 feet as well.
Okay.
All right. Okay, so the next thing we're going to do is we're going to do we're going to cover your eye. So you're going to cover your right eye, and I'm going to cover my left eye. And what we're going to do is I'm going to hold up some fingers in your peripheral vision, and you tell me how
Okay.
many fingers I'm holding up. Okay?
Okay.
All right. So cover your exactly. How many fingers?
2.
Okay.
1.
Okay, and we'll do it on the other side.
2. 4.
Okay, there's 3 there. Okay, no problem. All right. Okay, so the next thing I'm going to do is we're going to do what's called the cover-uncover test, okay? We're going to be
Okay.
checking for strabismus, tropia, phoria, anything of that nature, accommodation of the eyes, okay, from
Okay.
here to far. All right, so what I want you to do is cover up one eye. Okay, I'm going to grab my pen light here, and what I want you to do is focus on something behind me, and then uncover and stare right at this pen light. Okay, so I'm noticing there's no extra movements in the eyes. The eyes are nice and still, good accommodation of the eyes. So now cover the other, and we'll do the same thing. Stare behind me, and then uncover and look at the pen light. Okay, no strabismus noted to either eye. All right, so what I'd like to do now is have a look at the pupils. So I am noticing the pupils are nice and round, They're slightly dilated, probably about 3 millimeters right now. So I'm going to shine a light into the pupils, and we're going to look for some constriction. Okay.
Okay.
All right. And pupil went to about 1 millimeter then. And again to another about 1 millimeter on the right side. So I'm going to shine again, and we're going to do what's called the Hirschberg's test, and we're just going to check that the pupillary reflection of the light is right in the middle of that pupil where we want to see. Okay.
Okay.
And right in the middle there. And right in the middle there. So those are our normal expected findings. Okay.
Okay.
All right, so the next thing I'm going to do is use the ophthalmoscope, and we're going to go ahead and have a look at some of the internal structures of the eye, okay?
All right.
All right, so what I'm going to be looking for is first is that that reflex. It's called the red reflex, and I'm seeing it in the right eye. And then also what I'm looking for is that optic disc, and I'm looking to make sure that the optic disc is of normal size, the cup to disc ratio is normal, nice contours there, and then I'm going to be looking into the retina for any hemorrhaging, any exudate, any drusen bodies, which I see none in that eye. So good normal expected findings there. I'm going to go ahead and look into the left eye, okay? And I'm seeing the red reflex in this eye. And then looking again at that optic disc. Optic disc is nice and normal size. Optic cup to disc ratio is good. Contours are good, nice and smooth. And then looking at the retina again for hemorrhaging and drusen bodies and exudate, and I see none there. Okay. So good expected findings in the eyes. So the last thing I want to do with the eyes is just, I'm going to have you follow my pen light. We're going to go ahead and assess those 6 cardinal fields of gaze, okay?
Okay.
So don't move your head and just track with the light, okay? Or track with your eyes. All right. Good. Good. Very good. All right, perfect. That looks good. So the next thing I want to do is go ahead and have a look at the ears, the external structures of the ears. Is it okay if I move your hair back?
Sure.
Okay. So I'm looking at the ears, looking at the auricle and the pinna. No trauma to the ears, no swelling, no deformities, good normal size to the ears, nice and aligned, symmetrical as well. Patient does have several piercings in each ear, but no signs of inflammation, no redness, any pain.
No.
Okay, good. All right, so the first thing I want to do is we're going to do a gross hearing test. It's called a whisper test. So I'm going to have you occlude one ear, and then I'm going to say something on this side, and you just tell me what I'm saying, okay?
Okay.
All right.
Cat, ball, sink.
All right. And we'll do the other side.
Dog, house, picture.
All right, very good. So gross hearing is intact. The next thing I want to do is it's called the Weber test, okay? Oh, well, we got to get her out of here again. You're not allowed here, Missy. All right. Okay, so we're going to do the Weber test.
Okay.
What we're going to do, I'm going to strike the tuning fork, place this on your frontal bone, and then I want you to tell me if you hear it louder or softer in one ear or the same in both ears, okay?
Okay. It's the same.
Okay, she says same in both ears, so that's a normal finding. And the next thing I want to do is called the Rennie test. So the Rennie test is I'm going to make sure that the conduction is going to be, conduction of hearing is better through the air than it is through bone, okay?
Okay.
So I'm going to put this on your mastoid process. You tell me when you no longer hear it, okay?
All right. Down.
And again. we'll do the other side.
No.
Okay, and again.
No.
Okay, good. So conduction is better through air than it is through the bone for her, which is a normal expected finding as well. So I'm going to go ahead and do an otoscopic exam of the inner ear, okay?
All right.
All right, we're going to look at some of those internal structures of the ear. There we go. Okay. So I'm going to brace my hand right here on her shoulder, and I'm looking inside of the ear. And the first thing I notice is that the ear canal is nice and open. Some cerumen is present, and I can see the tympanic membrane. See, there's no perforation, no redness, no swelling to that membrane, and it is a nice gray, pearly color, which is a normal finding there, okay? And I'm going to come to the other side and do the same thing. So bracing my hand on her shoulder, looking at that inner ear, and again I can see the canal is nice and patent. Very little cerumen in the canal here, and looking again at that tympanic membrane, I can see that it is nice and pearly and gray in color. No perforations noted, no swelling, no redness. All right, so those are all expected and normal findings of the inner ear. All right. So the next thing I'd like to do is we're going to go ahead and I'm going to grab some. There we go. Let's see. Looking for one. There we go. All right. We're going to go ahead and have a look at the external structures of the nose. So I'm looking at the nose is also nice and symmetrical. No deformities to the nose. No masses. No lesions. I see no discharge from the nose. The septum is nice and centered and no deviation there, okay? So before we look inside of the nose, I'm going to do, we're going to check your olfactory nerve. So this is cranial nerve number 1. And you just close your eyes. I'm going to give you kind of a common familiar smell here, and you just tell me what that smell is, okay?
Peppermint.
Peppermint, that's correct. Very good. All right. Okay, so we're going to grab the otoscope again, and we're going to go ahead and have a look in the inside of the nose, okay?
Okay.
All right. And if you can just look up for me, I'm going to go ahead and brace my hand right here on your, and I'm looking inside the nair, and I can see no discharges, no bleeding, no swelling, and the nasal mucosa is nice and pink. No signs of infection there. Okay, we're going to do the other side. And I'm going to go ahead and brace my hand here. Looking inside the nair, also I can see that it's patent on this side. No bleeding, no discharge, and the mucosa is nice and pink, okay? If you can just occlude one side for me, take a nice breath in and out. Okay, and the other side. All right, good. Both nairs are patent. All right, so the last thing I want to do is we're going to have a look at the mouth, okay?
All right.
So I'm looking at the lips. Both are present. Pink lips, no cracking. They look to be moist, and no deformities in the lips. So I'm going to have you open your mouth for me. All right. So we're going to have a look at the gums. Yeah. Okay. Gums are nice and pink, moist, no recession noted in the gums. And now I'm going to look at your teeth. All right. Teeth are nice and white, aligned, open up, and I'm looking for any cracking, any chipped teeth, of which I see none there. Okay, I'm going to have you open your mouth up a little more, and we're going to kind of look into the oral mucosa. I'm looking for, any inflammation in the mouth, of which I see none. No patches, no lesions, nothing like that, no signs of infection. So if you'll just stick your tongue out and say ah.
Ah.
Okay, I'm noticing the uvula moves when she says ah, which is a normal finding. And then what I want you to do is stick out your tongue for me and move it from side to side and press it against your cheek. Press it against this side. All right, very good. All right, so that cranial nerve is intact as well. The last thing I'm going to do is we're just going to check for cranial nerve number 10, and I'm going to check that gag reflex, okay?
Okay.
Okay, so, well, and I'll also have you swallow. So go ahead and swallow. All right, patient is able to swallow. And we're going to go ahead and stick out your tongue, and I'm going to try to touch that soft palate. Okay, perfectly intact. All right, very good. Thank you, Miss Curry. All right, so the next thing we're going to do, we're going to move on to the next portion of the exam, and we're going to go ahead and look at the chest and the cardiovascular system and the abdomen, okay?
Okay.
So if I can just have you remove your shirt for me.
Okay.
So I'm looking at the chest now, and looking to see that the chest is symmetrical, that the anterior to the lateral diameters are symmetrical as well and proportionate. The skin is intact. I don't see any masses, no deformities of the chest wall. Looking at the breathing, I see the patient is breathing even, unlabored, normal depth in breathing. No accessory muscles are being used, and I see no flaring of the rib cage. Okay, so I'm going to go ahead and just palpate your chest. Okay,
All right.
and so I'm going to be kind of looking for chest expansion as you breathe. She has nice chest expansion there. And then what I'm going to do is palpate for, I'm going to check for tactile firmitis. So I'm just going to have you say 99.
99.
And again.
99.
Okay. And I'm using my ulnar aspect of my
99.
hand here to check for.
99.
Okay. I'm going to do the lateral side.
99.
Good.
99.
Okay. Again.
99.
Mm-hmm.
99.
Okay. Very good. All right, so I'm going to come to the back side, okay? And we're going
All
to
right.
look at the posterior areas of your lung fields. Okay, so I'm going to have you say 99 again.
99.
Okay, and again.
99.
And again.
99.
And one more.
99.
Okay, good. All right, so the next thing I'm going to do is I'm going to go ahead and start percussing some of those areas, okay?
Okay.
All right, and we're going to be listening for dullness and tympany in between these areas over the various lung fields, okay? A little dullness noted there. Nice and tympanic on that side. A little dullness noted there. Okay, I'm going to come to the lateral side. Good and tympanic there. There as well. Good tympany there, very good resonance, and good resonance there. All right, so I'm going to come back to the interior side. Very good resonance there. Resonance. Good resonance. A little more dull there where we're getting over the superficial area of the heart. Okay, so now I'm going to go ahead and start auscultating the lung sounds, okay? Again. Alright, so I'm going to use the diaphragm. And when you feel the stethoscope touch your chest, just take a big breath in for me. Okay, in, out. Again. Okay. And I'm hearing some higher pitched noises over the bronchi, and then those vesicular sounds again on the peripheral areas of the lungs. Lateral. Big breath in. Okay. Nice vesicular sound there. Again. Okay. And again. Good. And one more time. Okay, good low pitched vesicular sounds noted there. And back to the posterior section of the lungs. Big breath in. again. One more time. Okay. So I'm hearing the vesicular sounds in the peripheral areas of the lungs, and those higher pitched sounds over the bronchi, no adventitious sounds, no rails, no wheezing, no crackles or anything like that, okay? So those are all good expected findings. All right, so what we can do now is we're going to move on to the cardiovascular portion of the exam. So what I'm going to have you do is just lay back. We're going to have the patient at 30-degree angle, legs flat, very good. Arms at the side, okay. So the first thing I want to do is we're going to go ahead and auscultate that carotid. Well, I'm kind of looking at the jugular and the carotid pulses here. I can see very, very easily that they're obvious. Sorry, y'all. Okay. Next, I want to go ahead and I'm going to palpate that carotid pulse. Easily palpable on that side. No thrills noted. And easily palpable on that side. Again, no thrills noted. And I'm going to go ahead and auscultate those arteries as well. I'm going to use the bell, the stethoscope. And no thrills noted. Okay, again, no thrills noted there. All right, so what I'm going to do is I'm going to go ahead and palpate what's called the PMI. This is the point of maximum impulse. And this is going to be at the fifth intercostal space, about mid-clavicular line. So I'm going to palpate this for about 1 minute. And what I'm looking for here is I'm feeling no heaves, no thrills, easily palpable. Lasting for about 1 beat. And if I listened to that for a minute, or felt that for about a minute, we would have a heart rate of about 72 right now. Okay, so now what I'm going to do is I'm going to go ahead and auscultate the various areas over the heart, okay?
Okay.
So, using the bell of the stethoscope, I'm going to start at the second intercostal space. Right sternal border. And here I'm listening to the aortic valve. And moving over to the left sternal border, second intercostal space, I am listening to the pulmonic valve here. And then moving down to the third intercostal space, I'm listening to Erb's point. And no bruits are noted over any of these areas. Fourth intercostal space, listening to the tricuspid valve. And then again to the fifth intercostal space, mid-clavicular line, listening to the mitral valve. All right, no bruit is noted there. So I'm going to switch it over to the diaphragm, and we're going to listen to the sounds one more time. Again, at that right sternal border, second intercostal space, over the aortic valve, aortic area. I'm not hearing any additional heart sounds, just the normal S1 and S2 that would be expected. Back over the pulmonic, Erb's point, to the tricuspid, and then finally to the mitral valve again. Okay. So no bruits noted. All the normal sounds that we would expect to hear. No skipped beats, no extra beats, nothing like that. Okay, all expected findings. Okay, so I'm going to go ahead and I'm going to look at the pulses of the arms and look at the arms themselves. I'm noticing that the arms are nice and even, symmetrical. The skin is nice and uniform, no color changes. Skin tone, she's a type 2, which is normal for her ethnicity. And I'm going to do a little pinch test for turgor, and the skin returns back to its normal position very quickly. So here I'm palpating for that brachial artery, and that is easily palpable, 2+. And then I'm going to come over here over the radial aspect and feeling for that radial artery. And I'll call that about a 1+ there over the radial. I'm going to come to the left side and we're going to do the same thing. And that brachial artery is very easily palpable, 2+. And then again over the radial. That one is quite palpable, so 2+ there. All right, so is it okay if I touch, I'm going to go ahead and assess for the femoral arteries, okay?
Okay.
Okay. And that femoral artery is easily palpable at 2+ on that side. Jeez. And 2+ on this side as well. Okay. I'm going to go ahead and pull these joggers up. Looking at the legs. All right, so first thing I'm doing is I'm noticing no edema present on the legs, no swelling, no erythema, no varicose veins present, no venous tenderness or anything to that nature. So I'm feeling for the popliteal artery, that pulse back here in the popliteal area. And that's going to be easily palpable there, 2+. And on this side, again, easily palpable, 2+ on that side. I'm going to go ahead and remove the socks. See how we do it on time. All right, so the first thing I want to do is have a look at her feet. I'm looking at the feet to make sure that there is no swelling in the feet, no abnormalities, again, no swelling, no lesions or anything to that nature. I would be looking for capillary refill in the toes. We'd want to see about 2 to 3 seconds on the cap refill there. And then I'm going to go ahead and start feeling for these pulses, starting with the pedis dorsalis. And then again, I'm going to feel right back here for that posterior tibial pulse. And then I'm going to do it again on the left side, feeling for that dorsalis pedis. These are easily palpable, 2+. And again for the posterior tibial, again 2+ there. So good, normal, expected findings. I do want to come back to the hands and note a couple things about the hands. We'd be looking at any swelling of the hands, any cap refill. I'd be checking for capillary cap refill of the fingers, of those nail beds. She does have these nails on, so that would be difficult for me to see right now. But that's what I would be looking for. Also, about 2 to 3 seconds on the refill of the hands, and then I'd be looking at the nail beds for any signs of fungal infections. Looking for any clubbing of the fingernails, any signs of cyanosis, of which I see none on the hands. So good expected findings there, okay? All right, so the next thing we're going to do is we're going to go ahead and move on to the abdominal portion of the exam. Okay, so the first thing I'm doing is I'm doing a visual inspection of the abdomen here, noticing the abdomen is nice and symmetrical. There no scarring to the abdomen. Skin is intact. Looking at the umbilicus, I'm noticing there's no exudate or discharge or any signs of infection to the umbilicus either. So no masses, no lesions or anything of that nature to the abdomen. Okay, so the first thing I'm going to do is start to auscultate some of the areas in the abdomen and some of those arteries that we can find. I'm going to use the bell of the stethoscope. Coming just above the umbilicus, I'm going to be listening for the abdominal aorta. No bruise noted. Then I'm going to come just lateral to those, and I'm listening to those renal arteries. And then just below that, we're gonna be listening for those iliac arteries. Okay, so no bruits noted in those iliac arteries. Well, still need to, the next thing I'm gonna do is listen to the bowel sounds, and we're gonna use the serpentine method for the bowel sounds. I'm gonna start right here in the lower left quadrant. And I actually want to listen with the diaphragm here. And I'm going to be listening for up to 1 minute in all 4 of these quadrants. However, I'm hearing immediate bowel sounds, and we're going to come to this quadrant. Then back to the upper right quadrant. And again, I'll be listening to up to 1 minute in these areas. And I'm hearing immediate bowel sounds in all 4 quadrants. So that's good. Peristalsis is good. Okay, so the next thing I'm going to do is start to percuss these areas, okay?
Oh, okay.
Actually, one thing I want to do before we move on is I'm going to do what's called the scratch test. And we're going to be listening for the board. I'm going to put the stethoscope over the upper right quadrant here, and I'm going to start scratching, and I'm going to be listening for dullness to let me kind of understand where the borders of the liver are. Okay, so it becomes much more resonant and tympanic there. So extending about 6 centimeters down. Okay, so that's a normal expected finding. All right, so I'm going to go ahead and start to palpate the abdomen. So I'm going to start with kind of some light palpation over the abdomen here, and I'm feeling for the abdominal wall, making sure that's nice and mobile. Any pain or tenderness to that? Okay, good. All right, so I'm going to start with some deeper palpation, and I'm going to be feeling over some of those solid structures. So on the left-hand side here, I'd be feeling for that spleen. And you just tell me if you feel any tenderness or pain there. Okay,
No,
none
no.
there. Okay, how about any here?
No.
Okay. All right. And one thing I know that I did wrong, and I would have done this opposite, is I would have percussed this area first. But we can go ahead and do it since we're here, okay? So I'm going to be percussing over these solid masses again. I'm going to hear some dullness here. And then over here over the spleen as well. And then coming down, I should hear over these air-filled structures, we'll hear some more resonance. Okay, all right, good. So that concludes the abdominal portion of the exam, okay? So what I'm gonna do is, since you're already lying down, we're gonna move on to the musculoskeletal portion of the exam, but I'm gonna start with the extremities since you're already lying down, okay? All right, good. So I'm gonna start down here at the feet, and I'm just gonna have you push against my hands, and now pull against my hands. Very good. And can you do your ankles? Yeah, and now the other way. Okay, so she's got good range of motion, no limitations in those ankles there. All right, so what I want to do is I'm going to grab your leg here, and you just let me manipulate your legs. So we're going to do range of motion in the hips, okay?
Okay.
All right, so I'm going to go ahead and flex this right leg to her end point, which is about right there. So she's got very good range of motion there, and you can see that it can extend all the way. Now what we're going to do is I'm going to go ahead and test for internal rotation. So actually that bring it this way. Okay, internal rotation is good. Then I'm going to have you extend, and then this leg's going to come over on this side of it.
Okay.
And I'm going to come over here and I'm going to test for adduction. This is adduction. Okay, and then extend it. And I'm going to bring it up this way, and this is for abduction. And you have very good range of motion in the right leg. And I'm going to come over here, and we're going to do the same with the left leg. pushing that forward. Good flexion, good extension. We're going to do internal rotation, then we're going to do external rotation. Okay, and the next thing I want to do is abduction. And that's her endpoint. And then I'm going to have you this on this side, and we're going to do for adduction. All right, very good. Okay, so the next thing I want to do, we're going to do a few tests for the knees, okay?
Okay.
One of the ones I want to do is called the Lockman's test. And I'm going to place my hand right here on your thigh, and then I'm going to place it on the back side of your tibia, and I'm going to kind of pull against the knee here, and I'm looking for an end point to make sure that ACL is intact, okay? Any pain?
No.
Okay. So there's a definite end point there, which is very good. And we'll do the same on this side. Let's lock this test again. Okay. That's good. What we're going to do next is called the drawer test. So I'm going to have you put your knee at a 90-degree angle, about like that. And I'm going to pull the tibia forward, and we're just making sure that that tibia doesn't come forward more than it should, so that ACL is intact. And then I'm going to push it forward. And so that PCL, that posterior cruciate ligament, is in place, nice and intact as well. And we'll do the same on this side. PCL and ACL. All right, very good. So those are nice and intact. All right. So the next thing I want to do is the McMurray's test. So what I'm going to do with the McMurray's test is I'm just checking this knee, making sure that we have no meniscus tears. So making sure that there's no pain, no popping, no cracking whenever we flex that knee. And we'll do the same on this side. All right. Does that feel okay?
Yeah, that's fine.
Okay, very good. Okay, so the next thing I want you to do, we're going to do the heel to shin test. This is a neurological exam, so we're going to have you take the heel of the left foot and trace it up and down the shin of that right foot. So she's able to do that with no problems, tracing it nice and even and straight line, no tremors noted there. And we'll do it on the other side. Okay, very good. That's perfect. All right, so what I'm going to have you do is go ahead and sit up. Okay. And you can dangle your legs over the side here. And since you're already in the perfect position, we're going to go ahead and check these reflexes. So I'm going to check your patellar reflexes to begin. And that one is nice and intact. All right, good. And then I'm going to check the Achilles reflexes as well. Did you feel that?
Yes.
Okay, good. All right. Those are nice and intact as well. So I already have you in this position. What I'm going to have you do now is I'm going to have you, this is going to be kind of a rapid alternative movement test. You're going to take your hands, put them on your lap, and you're going to go back and forth as quickly as you can. Very good. All right, next I want you to take your fingertips and I want you to put it in the palm of one hand and then in the other. And then again, and then again. Okay, now I want you to trace your, touch each finger with your thumbs and then back. All right, very good. No problems there. All right, so next I'm going to have you close your eyes and I'm going to put an object in your hand and you tell me what this is. I'm testing for stereognosis. Close your hand. What do you feel?
A rock.
Okay. And we'll do the other side. What do you feel there?
The same rock.
Same rock. Very good. All right. So we're going to go ahead and continue with the musculoskeletal. So I'm going to have you stand up.
Okay.
Okay, we're gonna do the shoulders. Okay, so
All
I
right.
want you to press against my hand. Very good. All right, so I want you to lift your hands up, and then down, and then up like this. And we're gonna do forward rotation, and back rotation, and across the body, and the other hand, and then I want you to act like you're scratching your own back. So, can you do this? There you go. Okay, perfect. Yeah, that looks good. All right, so extend your arms up out like this. Press down against me. Palms up. Pull up. There you go. Okay. Now we're going to check your elbows, your bicep strength.
Okay.
So pull against me. pull in. Yeah, like this. There you go. Now push against me. Okay, very good. All right, so I want you to open and close your fingers, all right, and your wrist, back and forth like this. All right, very good. No limitations in any of the joints in the upper extremities. I want you to go ahead and squeeze my fingers. She's got really good grip strength as well. All right. Let's see, what do we need to do now? Okay, so what I want you to do is we're gonna have a look at your gait, okay?
Okay.
So what I want you to do is I just want you to walk forward. Okay, and then backwards, back towards me. So what we're doing is I'm noticing her gait, nice steady, even gait, no shuffling noted, no unusual mannerisms noted, okay? So that looks great. I want you to heel toe now.
Okay.
Mm-hmm. Okay, and back. Okay, so I'm gonna have you stand right here,
Okay.
feet together, eyes closed. We're gonna do the Romberg's test, and I'm just gonna assess your balance. This patient is able to maintain her balance with no problems, no swaying, no loss of balance there. Okay, we're gonna do the shallow knee test. So I just need you to bend your knees and act like you're sitting in a chair. Hear a little creaking there, but you're able to bend your
It's
knees.
my Achilles tendons.
It's your Achilles tendons.
Yes.
Okay, all right, very good. No problems there. Okay. Next thing I want to do is I'm just going to have a look at your back, and we're going to look at your spine here. I'm noticing a nice centered spine, no deviations in the spine from a straight spine, no lordosis, no scoliosis, no kyphosis noted back here. The back, the skin is nice and even. No color changes, no masses, no deformities to the back. The skin is nice and intact, and everything looks good back here. So we're going to go ahead and assess your spinal
Okay.
range of motion. Okay, so can you bend? Can you touch your? Yeah, there you go. And back up, and can you lean backwards? Okay, very good. And how about these lateral stretches like this? Yeah, and on the other side. Okay, and then we're going to rotate one way, rotate the other way. Very good. All right, I think we're getting real close to being done here. I just want to check over. This is my first check. Yeah. I think we're good, guys. All right, so that concludes our head to toe physical assessment. All right, thank you for your time.
Thank you.